Good morning, good afternoon, and good evening. And I would like to thank Mr. Francesco La Camera, Director General of the International Renewable Energy Agency, for his kind invitation to share a few thoughts with you today. IRENA is a key partner for the World Health Organization, and we're very grateful to the agency for its support in our efforts to promote clean and sustainable energy and to accelerate access to energy for health facilities. And I would like to thank the Director General, Francesco. The COVID-19 pandemic has highlighted the importance of health and health facilities. Last May, WHO published a manifesto for a healthy and green recovery from COVID-19 with 6 policy prescriptions and more than 80 specific actions. The manifesto highlights the importance of ensuring a quick and healthy energy transition based on renewable energy, as well as the need to accelerate investments in clean energy for health facilities. It is unacceptable that today about 1 billion people worldwide are still served by health facilities with no access to electricity, particularly in remote settings and rural areas. In sub-Saharan Africa, for example, it's estimated that 1 in 4 health facilities has no access to electricity. Even when electricity is available, the supply is often unreliable. This can mean the difference between life and death. Electricity is required for the operation of medical devices, lighting, clean water, communications, and other critical services. Surgery, safe care, storage of medicines, and so many other essential services need a steady supply of electricity. Now, with the COVID-19 pandemic, we need power for cold chain for vaccines, to operate oxygen concentrators and ventilators, and to supply clean water. Access to reliable energy for all health facilities globally will be essential for achieving universal health coverage. This is why the electrification of health facilities must be a development priority. Renewable energy presents a key opportunity to provide clean, reliable, and cost-effective electricity to health centers, including in remote locations. We have already seen substantial improvements in some countries, but we must do more and faster. This is our shared responsibility. Let me give you 5 key priorities. First, we need to dramatically increase investments on the ground. Second, we need to advocate for political commitment and resource mobilization. Third, we need to support countries in implementing healthy energy solutions so that healthcare can be delivered to poor and marginalized communities. Fourth, we need to create enabling policies. And fifth, we need to increase cooperation between the energy and health sectors, nationally and globally. To address these challenges, WHO and IRENA are working with the UN Development Programme, UNDP, the World Bank, the UN Department of Social and Economic Affairs, and many other partners in the Health and Energy Platform of Action, known as HEPA. HEPA aims to accelerate electrification of health facilities through renewable energy, as well as clean cooking, by bringing together key actors from the health and energy communities. Many of you have already joined HEPA, and I hope many more partners can join us soon. In the framework of HEPA, and in order to specifically address the need for increased political commitment and resource mobilization, I have recently convened the high-level coalition on health and energy. I'm honored that the IRENA Director General and many other leaders and champions have already agreed to join the coalition. I would like to commend IRENA for today's high-level session on identifying pathways to improve the health and well-being of the world's poorest through access to clean and sustainable energy. WHO stands ready to work with you, with all of you, to build a healthier, fairer, more sustainable future. Thank you, and I wish you a very productive meeting.